Today we are talking about BCG vaccine, which is one of the oldest yet most debated vaccine. Despite being over 100 years old, BCG remains a part of national immunization program in many countries, as TB burden is still high and TB kills millions of people every year. Today's lecture will focus on BCG vaccine in detail. Let's start with the history of BCG vaccine. In year 1908, two French scientists, Albert Calmetti and Camille Guerin, discovered BCG. They attenuated Mycobacterium bovis, and after 13 years of continuous culture, the result was BCG, named as Bacillus calmette-guerin. Let's see the preparation of BCG vaccine. This is obtained from live attenuated strain of Mycobacterium bovis. The Danish 1331 strain, which is the laboratory strain of Mycobacterium bovis, developed in Denmark, is used worldwide to make BCG vaccine, and that has been approved by WHO. BCG vaccine was first used in human in 1921, and it induces cell-mediated immunity. Types of BCG vaccine. There are two types: freeze-dried vaccine and liquid fresh vaccine. Out of this, freeze-dried vaccine is more stable than the liquid one, and this is the presently used vaccine in hospitals or worldwide. Since this is more stable, this is used. And this vaccine must be protected from sunlight exposure by wrapping in double layer of black cloth. And the container itself is dark brownish color like this, so that is to prevent from the sunlight. Storage and use. It is a freeze-dried, heat-stable powder in a vacuum-sealed dark vial. BCG is a multi-dose vial where it contains 20 doses with a vaccine vial monitor on the cap. So once you open, you can vaccinate 20 babies. It is stored at +2 to +8 degrees Celsius, and do not freeze this because it destroys the potency if you freeze BCG vaccine. And it can be given simultaneously with the polio pentavalent, DPT, TT, measles or MR vaccines, but you should be giving these at separate site if you give simultaneously. Now, efficacy of BCG vaccine. The efficacy is very variable. Protection of children against very severe TB is 80%. It gives 80% of protection against severe disease, severe tuberculosis, like TB meningitis, miliary or disseminated TB. So BCG is mainly for or against TB meningitis and miliary tuberculosis. It has 80% protection. Whereas for pulmonary TB, the protection is only 50%, so does not protect 100%. That is why the range of protection is very variable. It ranges from 20 to 80%. And duration of protection is 15 to 20 years. Age for vaccination. In the institutional deliveries, that is hospital or nursing home delivered babies, it is given at birth. So immediately after birth, you are supposed to give BCG vaccine. But in many cases, the baby, newborn baby, misses the dose at birth. So in this scenario, what to do? If the baby does not receive BCG at birth, then call the child as early as possible within 14 days. And many times home delivered babies, they come to hospital for their first vaccine at 45 days of life for the pentavalent DPT or OPV vaccines. So during this time also, if the baby has not received BCG, you can give BCG along with these vaccines. And up to 1 year age, whenever patient comes to you, you can give BCG vaccine, or you have to give BCG vaccine up to 1 year if the child comes, and if the child has not got BCG previously, then anytime you can give. Another commonly asked question is whether to do MON2 test or not before BCG vaccination after the neonatal period. So the recommendation is different in different places. Some countries they say after 6 months, and in some countries after 1 to 5 years you have to do MON2 test, that is a TB screening test, before giving BCG vaccine. So if the MON2 test comes out negative, give BCG vaccine, and if the MON2 is positive, that indicates the child might have tuberculosis. So in this case you don't give BCG vaccine, but you rather evaluate the child for TB and then treat accordingly. And more than 5-year-old, BCG vaccine is not recommended, but in a high risk group or high risk countries it might be required. If you give, that will be after doing the TB screening test. And in TB burden countries, recommendation is to give BCG vaccine without doing MON2 test in children less than 1 year, and sometimes even for children less than 5 years no need to do MON2 test. The reason is MON2 test is just a screening test which indicates sensitization and not the TB disease yet. So if you don't give vaccine, if the MON2 test is positive, then there will be many dropouts. So the prevention against severe childhood disease will be less. So that is why, for this reason, for protecting the child from severe disease, you have to give BCG vaccine even without doing MON2 test. So that is the recommendation for high burden countries. Now dose and site. This is a single dose vaccine. So dose is single dose. Time, newborn period till less than 1 year. Dose is 0.05 ml intradermal. The reason you are giving 0.05 ml for less than 1 year children is the skin is thin, so full dose if you give, that will lead to abscess formation, which is a complication. And children 1 year or more than 1 year, you give 0.1 ml. Route intradermal. Site will be at the insertion of the deltoid in the upper arm, because at this site, usually you give at the insertion of the deltoid. At this site, complication is least, and the complication is usually keloid formation. Administration, you use BCG syringe or tuberculin syringe. Those are auto-disposable syringes, and this vaccine has a diluent which is supplied by the manufacturer, and this diluent is 1 ml normal saline. After reconstitution, it should be used within 4 to 6 hours. Discard the unused vaccine after this time. After 4 to 6 hours you have to discard the vaccine, and no spirit or antiseptic is applied over the site before injection. Reaction following vaccination. This is important, the phenomenon, what all happens after giving the vaccination. Immediately after you inject, there is a wheal or a swelling of 6 mm seen, which is raised above the surface, and this disappears after 6 to 8 hours, and the injection site looks totally normal. After 6 to 8 hours, it seems the child has not received a vaccine because it is totally normal. The wheal disappears. Let's see the phenomenon after vaccination. After 2 to 3 weeks of injection, a papule reappears. Just follow this picture, picture number 1. It looks like this. Then papule induration becomes 4 to 8 mm in size at 5th week of vaccination. Then nodule and pustule gradually become soft with the formation of shallow ulceration and a crust formation that will be at 5 to 9 weeks after the injection. Then it gradually heals with the formation of scab, and a scar is formed at 9 to 12 weeks of giving vaccination. So the total duration is 12 weeks. Complication of BCG vaccine. Pain, scarring can occur and a keloid formation at the injection site. If the site is not correctly selected, then there will be keloid formation. So this picture is showing the keloid formation. If BCG vaccine is given subcutaneously instead of intradermal, then there will be a local abscess formation which is called BCGoma. It spreads to the regional lymph nodes, causing abscess formation and then leading to suppurative lymphadenitis. This happens in 1 to 10% of cases, so this time you need to treat the child with the antibiotics. Then another complication is BCG adenitis, known as BCGosis. There is a cervical or axillary lymphadenopathy. This is non-suppurative. So in this scenario, the baby might require treatment with the INH prophylaxis. INH is isoniazid. So this picture, you can see keloid formation, second picture abscess formation, and third, this is a BCG adenitis. This is a non-suppurative lymphadenitis. And some rare complication is if BCG is given in immunocompromised patient, then it can cause disseminated tuberculosis. This is a rare complication which might occur in less than 1% cases, and if it occurs, it is a very life-threatening condition. BCG osteomyelitis can occur sometimes, and BCG acceleration reaction can be seen, and prolonged persistent ulceration can occur in 1 to 10% of cases. Contraindication of BCG vaccine: if the person is having a cellular immunodeficiency, symptomatic HIV, where there is a cell-mediated immunodeficiency, and hypogammaglobulinemia, pregnancy, immunosuppressive therapies, corticosteroids or radiotherapy if a person is getting, then you should not give BCG vaccine at that time. Some other uses of BCG vaccine can be, it is used in the superficial bladder cancer. Here you instill the BCG vaccine directly to the bladder, and then here locally it stimulates the local immune response and then prevents the recurrence. And sometimes there is partial protection against non-tuberculous mycobacterium also with the BCG vaccine. Like in leprosy, it gives 60 to 80% of protection. Okay, the key points is BCG is single lifetime dose or single dose vaccine. It best protects when it is given early in infancy. It is contraindicated in immunodeficiency, especially the cell-mediated immunity, symptomatic HIV, primary immunodeficiency, chemotherapy or high-dose steroid, pregnant woman, and then active TB. So these are few contraindications. And remember, BCG is not a universal vaccine. It is given based on the TB risk. So for high TB countries, especially the developing countries, you need to give BCG vaccine. But in low TB countries or the developed countries, it is not a compulsory vaccine, not a routine vaccine, but it is given only for the high risk population. Okay, thank you. Next class we'll do pentavalent vaccine. Thank you.